Stairs hurt. Sitting too long hurts. Even sleeping on your side at night hurts. If that one-sided low back pain keeps flaring up when you stay in one position too long, the sacroiliac joint might be the real pain driver. Most people with SI joint pain have never had this explained clearly, so let me show you the full picture. From what you can do at home right now, step by step, all the way to advanced medical options. By the end, you'll know exactly where you are in this process and what to do next. I'm Dr. Moving Better, physiatrist. Let's get you some answers. The SI joint's job is simple. Move load from your upper body into your legs, like a force transfer bridge. But when your stabilizers, your core, your glutes, get weak or imbalanced, those forces shift into the posterior ligaments and supporting structures. Those structures bear more than they can handle and get irritated, and then pain shows up. But now you understand why it gets irritated, we can strategically treat it. In the first few days of sacroiliac pain, your goal is to calm the inflammation. Start with your triggers, what sets the pain off, and what makes it flare the most. Minimize those activities for now, but don't shut your body down. Static positions are the real enemy. Stillness stiffens the joint, making the ligaments angrier. So, give your back some support. Use a lumbar roll with sitting to unload your spine. Avoid early single leg loading. Use the handrail on stairs for support. If tightening a belt around your waist helps, and a lot of people discover this by accident, consider trying an SI joint belt, but it's temporary support. It's important that you don't stay in one position too long. But here's the problem with sleep. It's not practical to strategically move when you're sleeping, so you modify your sleeping position. The best position is on your back with pillows under your thighs. Side sleepers, place a pillow between knees. Stomach sleepers, place pillow directly under your hips. Do gentle stretching in the morning and before bed if you can tolerate it. If it hurts, stop. Overall, the take-home message is staying in a static position will worsen the pain as the joint gets strained. You can use ice or heat to soothe sacroiliac pain. As a general rule, think of using ice and heat this way. If you've had a long day moving around and the joint feels inflamed, cool it down with ice. But if you're sitting at home on a rainy day and it starts throbbing, heat may relax the surrounding stiff muscles and connective tissues, giving you some relief. Ultimately, listen to your body. If heat or cold makes the pain worse, stop. And if appropriate for you, short-term medications like non-steroidal anti-inflammatory drugs or acetaminophen can take the edge off. Some people explore anti-inflammatory diets, things like turmeric or ginger, but the evidence for SI joint pain specifically is limited. Treat this as supportive, not primary treatment. And don't overlook this. Mindfulness, cognitive behavioral therapy, and even gentle yoga reduce fear of movement, because fear is one of the biggest obstacles to recovery. Once the acute pain cools off, the real recovery begins. The foundation of self-recovery is consistency. Even 5 minutes a day beats 1 hour once a week. The SI joint needs support from the ligaments, muscles, and other supporting structures. Recovery involves core work, pelvic stabilization, and hip mobility. And make sure to stretch and warm up before engaging in any exercise. This is where physical therapy is golden, not just for exercises in the clinic, but for learning controlled, precise movement patterns that translate into everyday life. There's also manual therapy, manipulation, or mobilization, which might help, but results are usually short-term. The durable gains come from the exercises you repeat daily, not the treatment done to you. Progressive strength, better gait mechanics, improved motor control and stability. This is how you make progress with recovery. If pain stays high after a solid run of conservative care, it's time to confirm the pain generator. This is where image-guided SI joint block is used. If you get 50 to 75% relief, the SI joint is a very likely source of the pain. Some clinicians combine anesthetic with a corticosteroid to create a short-term relief window, a period where pain drops enough to let you strengthen effectively. Here's something interesting: the scientific literature notes. Peri-articular steroid injections, those done around the joint, the ligaments, and supporting structures, may actually have stronger evidence of benefit than strictly intra-articular ones. That tells us something powerful. We're not just treating the joint, we're treating a system of ligaments and stabilizers. If the relief from blocks is real but short-lived, then radiofrequency ablation, RFA, becomes an option. We target the small nerves carrying the pain signal from the SI region, typically the lateral sacral branches and L5 dorsal ramus. We interrupt those signals. Relief can last up to 1 year, with improved function in the right patients. But let me show you the part many people miss. It doesn't fix the underlying mechanical problem. It's just a temporary band-aid that buys you some time. But what you do with that time, stretching, strengthening, building stability, determines your long-term outcome. Rehabbing yourself keeps it. The more stability you build while RFA is helping, the lower your risk of relapse later. PRP and Prolotherapy get a lot of attention, but let me show you the truth. The evidence is mixed. One trial showed PRP outlasting steroid. One study from 2017 suggested PRP may last longer. A 2022 randomized trial found steroid performed better at key check-ins. So here's the honest guidance. These aren't first-line treatments. They're adjuncts. Options for select patients when standard steps fall short and expectations are realistic. Also important, these treatments aren't cheap, and insurance often doesn't cover them. Point: make sure you discuss the cost, the uncertainty around outcomes, and your specific goals with your provider before moving forward. Finally, you've tried everything and nothing else works. Surgery is the last step in the ladder, but not for everyone. Minimally invasive SI fusion is reserved for severe refractory pain that's been confirmed through documented failure of conservative care, physical therapy, procedures including diagnostic blocks and imaging to rule out other causes. If you're at this stage, bring your printed SI joint treatment tracker. It helps your medical team see the whole picture. And remember, reaching this step doesn't mean you failed. It means you exhausted every reasonable option and you're making an informed, evidence-based decision. Once you're better, the goal is staying better. Maintenance and consistency are key. Maintenance doesn't require an hour a day. Meaningful micro-sessions, 5 to 10 minutes of strength, mobility, and posture a few times a week can make a difference. If symptoms flicker, slow down, calm down the irritation, reactivate your core and glutes, check your ergonomics, then build up again. You're not fragile. You're rebuilding. Download the SI Joint Treatment Tracker in the description below. Follow the phases. Bring it to your clinicians. Use it to stay on track. While this video is not individual medical advice, I hope you found this helpful and gained clarity on your recovery. I'm Dr. Moving Better. Join me in the next video. Let's keep moving forward.